Hey guys, how's it going? So, at the start of the episode, I want to thank everyone who's been watching the channel and who has been tuning into the channel. It means the world to me if the content that I'm doing on YouTube is of any value, any benefit for you. It means so much to me when I receive a thank you letter on Reddit or my email saying that the kind of content that I upload or the things that I write on Reddit really help someone or some people. That means so much for me, and for that I want to thank you. I want to thank you for giving me the chance to tell you about my insights and the ideas and impressions that I have about borderline personality disorder. Now, regarding today's episode, I want to talk about a common clinical manifestation in borderline personality disorder, which is chronic emptiness, or the feelings of chronic emptiness. And as it is usual, I use Microsoft Word. I hope in the future I find a very convenient program and easier to use than Microsoft Paint, but with better visuals. Chronic emptiness. And I think black is a nice color for this description, because this is such a negative term if you think about it, chronic emptiness and how it happens. This is one of the manifestations that happen in borderline personality disorder, and they can cause a great deal of effect on the person. So this symptom affects different aspects of the personality. It can go on relationships, it can go on self-behavior. So there's an outward and there's an inward effect of this kind of feeling. Now, the outward effect happens in two ways. It can represent itself in relationships, and it can reflect itself in behavior. So the chronic emptiness, if it's projected outwards, it projects on how we interact with other people around us, and it projects on how we behave in a setting that may involve other people directly or indirectly. Now, what about inwards? Now, inwards is how how this chronic emptiness affects us. Now, of course, if you really want to analyze it logically, this year would lead to this year. So the cascade would go from here. It would start here inwards, it affects us internally, and then goes all the way to the outwards behavior, representing itself in either relationships or behavior. And the effect of this chronic emptiness on these two aspects in life is very dangerous. Why? Because to understand chronic emptiness, sometimes you get it confused with depression or sadness, and you have to know that chronic emptiness is not depression or sadness. And this is a commonly confusing aspect, because having depression or having sadness involves symptoms of chronic emptiness, so they're interchangeable in terms of them happening together, but they're not the same. And you being able to reaching the capability of differentiating whether you have this or this is a high level of insight that you are required to have in borderline personality disorder, right? You're required to know how to differentiate between the two. Now, this is hard sometimes because there's a common comorbidity in borderline in which you have clinical depression associated with borderline personality disorder. So differentiating the two can be quite of a difficult task. But I'll tell you a clear way how to differentiate the two. Now, to understand the definition of chronic emptiness, the way I would describe it is having an overwhelming, or no, not overwhelming, let's say the core feeling of boredom. Now, that's a feeling that everyone can relate to. Everyone understands boredom. I want you to multiply this by 10. So what happens if you feel bored as a person? You do things, right? You want to do things so you can remove the boredom. You're sitting home, you're bored, you want to play a game, you want to go out, you want to see someone, you want to do something, right? Well, in chronic emptiness, the boredom is duplicated so many times. It's a very intense feeling of boredom that it starts to impact your idea of doing things. So the normal person would feel bored, and as a result would start to do things. In chronic emptiness, you're not able to do that. Chronic emptiness is a boredom that is multiplied and exaggerated, causing you to get discouraged of doing things. There is no internal motivation. And this is the meaning of chronic emptiness. That's the best way how to describe it. And you can notice there is no aspect of sadness involved here. This is not sadness. You have this pathway in depression, but it's not depression by the symptom of sadness. It's an isolated feeling of intense boredom that you go through. And this is it affects borderline in a bad way, and it's not really that it's not considered one of the symptoms that are really, really dangerous in borderline personality disorder, but I would differ on that. So if you go to a psychiatrist and you tell them I have borderline personality disorder and the main symptom that I'm suffering from is chronic emptiness, they're not going to be too worried about it, because they're going to try to approach cognitive approaches and trying to explain to you how life is not boring and it's actually nice, and you just have to change your way of perceiving things. And that approach is dangerous. Why? Because this chronic emptiness can represent itself in this pathway that I just explained to you. It's inward, you feel it, and then it represents itself outward. How does it represent itself outwards? Now, in behavior, they call this novelty-seeking behavior. So if you're suffering from this chronic emptiness and you're having this chronic boredom, you're going to be the type of person who is going to seek activities that are novel, risky, dangerous, unique, anything that gives you the thrill of being alive. And although this might be a good thing, the problem in this is that you're going to have high expectations and a high rate of discouragement. So I'll write this down. Expectations are very high, and the rate of discouragement is also very high. Now, what do you have to do if you want to do something novel, if you want to do something crazy in your life? What do you have to do? You have to start with steps, right? You have to start with 1, 2, 3. You have to start in a gradual hierarchy of how things work in life, and you're not going to be able to do that because your expectation is so high. You want to reach rank 10 from the thing that you want to do immediately, and you want to skip all those boring baby steps that you have to do at the beginning. And the fact when you realize that you have to go through them, oh my god, this gives you a huge amount of discouragement. And this discouragement destroys everything. So this novelty-seeking behavior is a kind of aspect that you have in your personality that disables you from doing small tasks, and it prevents you from reaching the high tasks that you want to fulfill in your life. So in that sense, it's not good. But in the sense that you want to reach something great in your life, it is good. It's just on how you apply it. And applying it is going to be very difficult due to the chronic emptiness that you feel. How does it affect relations and relationships? Or before I go to relationships, there is also another aspect, which is risk-taking behavior or risky behavior. So if you have this chronic emptiness, you want to be having something thrilling in your life, and not just in your professional life and novelty seeking, but also on the short term. So you might understand that a behavior can be good and can be bad, and you know clearly that it is that way. However, you still choose the risky behavior because it just makes you feel alive. So you go and you drive recklessly, you go and you pick a fight, you go and you do something, substance abuse or anything where you have lots of fun and lots of thrill because that makes you feel alive again. Now, realizing that this is all stemming from the chronic emptiness makes you think twice before you choose this. Now you know, okay, this is coming from the chronic emptiness. Am I still going to do it or not? So this reinforces your insight and reinforces your ability to monitor yourself. What happens to relationships? If you're in relationships, one common thing that happens in relationships is stagnation. This is very common. This happens in all relationships, and lots of people don't know whether this stagnation is a result of chronic emptiness or if it's a result of natural stagnation. So a couple who's been together for 40, 50 years, they're stagnant, right? The initial flame of the relationship might not be there. In borderline, this can happen after a few months. And then you don't know, is this stagnation a natural one or is it chronic emptiness? You don't understand yourself anymore. The person you were really attracted to suddenly became boring. And the reason for that is the same. There is something inside you that is causing you the chronic emptiness that allows you or enables you to have this exaggerated boredom. And I'm going to come back to that in a moment. And that affects lots of things in addition or including relationships. So you feel stagnation. And then you try to rationalize this stagnation. You try to find reasons why you're feeling bored in the relationship because you don't know that this is caused by your condition. You think there are reasons for it. You think, oh, maybe it's the looks. Maybe it's the activities that we do. Maybe because we have relationship goals. Maybe it's myself. I'm not happy with myself. So you try to find reasons why you're bored. And believe me, no matter what you're going to do to solve these reasons, you're still going to go back to what? You're still going to go back to this. So it's an endless loop, and you're not going to be able to solve it. So don't even try to rationalize the stagnation in a relationship. Just don't act on it. Don't act on it. So you know that this stagnation and boredom that you feel in a relationship is a result of this. So don't act on it. Say to yourself, okay, I feel it, but it's not true. It's not my original feeling. And I know it's giving me a hard time in enjoying the relationship, but this is the only thing I can do right now. So why does this even happen? What is wrong in our brain that is causing us to feel this chronic emptiness? And by the way, this is also a cause for risky behavior that is sometimes resulting in damage, self-damage, self-mutilation. I've heard about lots of people who cut, and I don't cut myself. I've never been the person who has inflicted self-damage in that way. So it was hard for me to understand why people cut who have borderline personality disorder or do any kind of self-damage. And I realized that one of the reasons that they're always saying is that they feel alive when they start to cut. The pain makes them feel alive, and not the pain per se, but the relief of pain when it goes away is making them feel alive. And I'll explain why this happens and why you go through this chronic emptiness. And this is an aspect in borderline personality disorder that has not been yet fully researched. So there is a relation between impaired dopamine signaling in the brain and borderline personality disorder. So the correlation between impaired dopamine signaling. So dopamine is a neurotransmitter that is transmitted in neural synapses. So in between neural cells, you have dopamine as a transmitter. Now, impaired dopamine signaling can be either two. It can be either high or it can be low. So what happens when it's high? And I'm going to go into this chemical aspect now because this is going to give you a lot of insight on why this whole nonsense happens here. So if dopamine signaling is high, it means you have two cells, right? And you have a synapse in between them. You have dopamine going from one to the other. Now, if the dopamine receptors are in huge abundance or the production of dopamine is really high, you have an increased dopamine signaling. What happens? You get symptoms which are related to schizophrenia. So hallucinations, psychosis, and mania. Mania means an elevated mood. You're really, really hyperly active and in a really pathological way. So these are the symptoms of increased dopamine signaling: hallucination, psychosis, mania. What happens if it's low? The opposite. Not the opposite, but a better way to describe it is feelings of chronic emptiness, boredom, loss of motivation, and no drive. So these are the symptoms of low dopamine signaling. So it's either that the dopamine production is low, or that the receptors of dopamine are impaired, allowing dopamine not to be attached to the receptors. So it's either one of those two that causes dopamine to be low. And in the middle you have normal dopamine signaling. So this causes you to be a normal person, right? And if you take drugs that elicit or are agonists for dopamine release, you get these symptoms. Even if you're a normal person, you can still replicate these symptoms, right? And that's pretty crazy. And if you take drugs, if in schizophrenia, for example, you have a natural impairment of dopamine signaling, which is causing it to be high. So what we give you, or what a psychiatrist would prescribe to you sometimes, is an antipsychotic, which does an antagonistic effect on dopamine. So the difference between agonist and antagonist is that antagonist, just like in movies, the movie antagonist, is doing a counter effect. So if you give the schizophrenic patient a dopamine antagonist, it blocks the dopamine of being attached to its receptors. And then the high dopamine signaling goes back to normal, and the symptoms of hallucinations go away, right? So that's the thing. Now, in borderline personality disorder, what of the three conditions is more likely? Is it more likely high, low, or normal? Well, it's something in between. It's fluctuating between low and between normal. So that's the difference. So this is an important difference. It's quite precise, actually. So sometimes you have the confusion between bipolar and borderline personality disorder. And I know these terms might be confusing for someone who's watching this video for the first time, but if you have some background in it, in bipolar, the condition of bipolar, you have a situation of ups and lows, ups and lows, ups and lows. So this is the baseline. Here is happy and here is sad. And the thing is that in bipolar, this here is depression and this here is mania or hypomania, which is a really elevated mood, and this here is sadness and depression and chronic emptiness. So it goes up and down, goes up and down. Now the problem is that in bipolar, this happens on the course of days. So this period might take a few days, then this period might take a few days, then this takes a few days. And there is no reason why it happens. It just happens naturally in bipolar. That's not the case in borderline personality disorder. This does not happen in borderline. It's not an up and down. It's a down and normal. You see the difference? In borderline, it's like this. It goes down, goes back to normal, goes down, goes back to normal, goes down, goes back to normal. And fortunately so. So if you have borderline and not bipolar, you can be happy. Because this does not happen, and this is this is much more difficult to deal with. This here is better. Why? Because you have situations in which you are normal. And the time frames are not days, they're just a matter of hours. And there's always a reason why you feel this kind of down. It doesn't come out of the blue. The chronic emptiness per se does come out of the blue in borderline. But everything else, like sadness, depression, and any other symptoms other than chronic emptiness in a low, happens due to a reason in borderline. It might be very small, so small that you don't even remember what it is, but it's always due to a reason. And when this reason subsides, and the effect of this reason subsides, you go back to normal. So that is the dopamine signaling impairment in borderline. It's either low or back to normal. And when it's back to normal, you find that the borderline person is productive, happy, because now he's not high, he's not in an elevated mood. He's just happy that the low is gone, and that makes him feel really good. So he becomes productive and creative again. Now, this hypothesis is not really confirmed yet, but there is a high likelihood that this is the case, and there are a number of reasons that support this hypothesis. One of the reasons or hypothesis why this is correct is that there is a common comorbidity in borderline, which is ADHD, the attention deficit disorder, and this disorder is surprisingly more studied than borderline personality disorder in its chemical aspect. And patients who have borderline personality disorder and attention deficit disorder are given dopamine agonists. So the opposite to the schizophrenic medication, you give them something that increases the dopamine signaling, and the results have been really positive. So this indicates that there is impaired dopamine signaling in patients with borderline. Now the problem is that they were diagnosed with both BPD and ADHD, right? So you don't know, is the impaired dopamine because this or is it because that? And because the trials were done on patients who have both, you don't know for sure. But here's the thing, the possibility of it being related to borderline personality disorder as a core, resulting in symptoms of ADHD, is a very likely possibility. So in this situation, you want to give the patient with borderline personality disorder a dopamine agonist, and I have not tried this out yet, but I will try it out shortly. I'm going to try to take the proper medication and the proper dosing for a dopamine agonist that has a low rate of dependence, so you don't get the symptoms of dependence. And I really want to see what happens to the chronic emptiness. Is it relieved or not? And if it's relieved, and you know that it's not a placebo effect, that is unbelievable, because this kind of rationale is not really used in borderline personality disorder. If you go to a psychiatrist and you tell them I have chronic emptiness, they're not going to prescribe you dopamine agonists. This whole link between this and this is not yet present in clinical practice. It's not yet there. But I'm telling you, this is where it's supposed to head, and this is probably the future of the research. Okay, you have chronic emptiness, all right, that's dopamine impairment. In this dopamine signaling impairment, we're going to give you dopamine agonists. We're going to see if you go back to normal. You have the motivation and the enjoyment in doing things and in doing normal, regular tasks like everyone else, right? So that was the explanation of dopamine and how it affects, how this here affects the chronic emptiness that you feel in borderline personality disorder. And also what you have to know is that realizing that it's a chemical imbalance in dopamine should make you understand not to act on it. So, okay, if you have the novelty seeking behavior, that's nice, but you have to understand that you should not get discouraged of doing the 1, 2, 3 baby steps of anything in life, because the discouragement is not real. It's just a feeling that you feel because of the dopamine. And in relationships, you should not act on the boredom and stagnation that you feel because it's a result of the dopamine. It's not a result of rational thought. It's not a result of losing interest. So remove that anxiety from your head. You can blame it all on this. And I'm going to be updating you with whatever results I get from the experiment or the case study with dopamine agonists. And I hope it's going to be effective. Thank you guys for watching the video. Give me a like, give me a subscribe. I hope that this channel really provides the help that it is intended to provide for those people who needed. Thank you very much, guys.